बिस्मिल्लाहिर्रहमानिर्रहीम। फार्माकोलॉजी BSN थर्ड सेमेस्टर एंटीन्यूप्लास्टिक ड्रग्स KMU के स्लाइड्स हैं। तो इसमें ऑब्जेक्टिव्स हैं कि कैरेक्टरिस्टिक ऑफ नॉर्मल एंड मैलिग्नेंट सेल, कैरेक्टरिस्टिक ऑफ एंटीन्यूप्लास्टिक ड्रग्स, क्लासिफिकेशन ऑफ एंटीन्यूप्लास्टिक ड्रग्स, डिस्कस द नर्सिंग केयर ऑफ द पेशेंट, कैलकुलेट द ड्रग डोजेज फॉर एंटीन्यूप्लास्टिक ड्रग्स। इज़ वेरी सिंपल। सो स्टार्ट करते हैं इंट्रोडक्शन से कि नॉर्मल सेल किस तरह होते हैं। नॉर्मल सेल डिफरेंशिएटेड होते हैं। डिफरेंशिएटेड का मतलब होता है कि नर्वस सिस्टम के अपने सेल्स हैं, बॉडी मसल्स के अपने सेल्स होते हैं, और किडनी के अपने सेल्स हैं। तो हर ऑर्गन के डिफरेंट साइज़ और शेप के सेल्स होते हैं। इसका मतलब डिफरेंशिएट का मतलब ये है। और नॉर्मल सेल का जो ग्रोथ होता है वो बैलेंस होता है। जब ये ग्रोथ एबनॉर्मल हो जाए, ज़्यादा ग्रोथ करे, दिस कंडीशन इज कॉल्ड ट्यूमर। मैच्योर होता है और डिवाइड करते हैं। रेगुलेट बैलेंस एंड सेल बर्थ एंड सेल डेथ। उसकी सेल बर्थ और सेल डेथ के दरमियान एक बैलेंस होता है। रेगुलेशन इंट्रासेलुलर सिग्नलिंग के थ्रू होता है। हाइपरप्लेसिया मीन न्यू सेल्स प्रोडक्शन विद ग्रोथ स्टिमुलस वाई हार्मोन्स इंडोजीनियस सिग्नल्स के थ्रू उसमें सेल का ग्रोथ होता है। हाइपरप्लेसिया ऑफ द endometrial tissue during menstrual cycle is normal and necessary, but if intense prolonged damage may सेल स्ट्रक्चर या फंक्शनल एबनॉर्मेलिटी अगर अगर किसी वजह से उसको कोई स्टिमुलस मिल रहा है तो उसकी सेल का स्ट्रक्चर और फंक्शन एबनॉर्मल हो जाता है। मेटाप्लेसिया रिप्लेसमेंट ऑफ वन सेल टाइप बाय अनदर। इंट्रोडक्शन। डिस्प्लेसिया रिप्लेसमेंट सेल्स Dysplasia replacement cells are a disorder in size, shape, increase mitosis rate. This is called dysplasia. Neoplasia, abnormal growth, invasion of the cells. न्यू ग्रोथ, न्यू प्लाज्म, ट्यूमर या इरिवर्सिबल होता है। सेल रिप्लिकेट करता है, ग्रो विद आउट ऑफ कंट्रोल। सेल की ग्रोथ होती है आउट ऑफ कंट्रोल। दिस इज कॉल्ड न्यूप्लेसिया। What is neoplasms? Tumor, growth of the neoplastic cells. Two major types, benign and malignant. This is the type of tumor. Benign what is benign? Benign जो होता है वो नॉन कैंसरियस होता है। लोकल सेल्स कोहेसिव होता है। वेल डिफाइंड बॉर्डर्स होते हैं। पुश एडजेसेंट टिश्यू अवे, डज नॉट स्प्रेड बियॉन्ड ओरिजिनल साइट, ऑफन हैज़ अ कैप्सूल ऑफ फाइब्रस कनेक्टिव टिश्यू। ये बिनाइन ट्यूमर के करेक्टरिस्टिक हैं कि वो और जो एडजेसेंट टिश्यू होता है उससे अपने आप को उसमें डिस्ट्रीब्यूट नहीं होता। और मलिग्नेंट सेल जो होता है ये मलिग्नेंट सेल ग्रो करता है और मोर रिपीटली। इसी वजह से हम मलिग्नेंट ट्यूमर को कैंसर कहते हैं। नॉट कोहेसिव, सेल्डम हैव कैप्सूल। इसका अपीयर कैप्सूल नहीं होता। इरेगुलर शेप इसका होता है और डिस्टर्प्टेड आर्किटेक्चर भी इसका होता है। इन्वेट सराउंडिंग सेल्स, कैन ब्रेक अवे टू फॉर्म सेकेंड ट्यूमर, मेटास्टासिस फ्रॉम 1 to 2 साइड। Some basic facts about cancer. Cancer cells have lost the normal regulatory mechanism that control cell growth and multiplication. Cancer cells have lost their ability to differentiate. तो benign cancer cells stay at the same place होता है। और malignant cell जो होता है invade new tissue to set up a secondary tumor. दिस प्रोसेस इज कॉल्ड मेटास्टासिस। तो malignant सेल में मेटास्टासिस होता है, अदर टिश्यू को ये प्रोमोट हो जाता है। और बिनाइन सेल जो होता है वो नॉन ट्रांसफरेबल होता है। केमिकल काजिंग कैंसर आर कॉल्ड म्यूटाजेन। वो केमिकल जो कैंसर काज करे उसको हम म्यूटाजेन कहते हैं। कैंसर कैन बी काज्ड बाय केमिकल्स। ये केमिकल से हो सकता है, लाइफस्टाइल, स्मोकिंग की वजह से या और वायरस की वजह से होता है। जीन्स दैट आर रिलेटेड टू काज कैंसर आर कॉल्ड ऑन्कोजीन्स। वो जीन्स जो कैंसर को जो जिससे कैंसर हो जाता है उसको ऑन्कोजीन्स कहते हैं। जीन्स दैट बिकम ओनोजेनिक अपॉन म्यूटेशंस आर कॉल्ड प्रोटोऑन्कोजीन। कैंसर या न्यूप्लास्टिक। कैंसर अकर ऑफन नॉर्मल सेल्स हैव बीन into neoplastic through their genetical mutations and abnormal expression of the gene. तो जीन की abnormal mutation की वजह से कैंसर अक्सर हो जाता है. Neoplastic cells usually exhibit chromosomal abnormality and the loss of their differentiated property. These changes lead to uncontrolled cell divisions and many result in the invasion of previously unaffected organ. The process is called metastasis. This is the mechanism कि सेल साइकिल नॉर्मली चल रहा है तो उसमें किस तरह डिस्टर्बेंस आता है. फॉर एग्जांपल सिंथेटिक फेज या स्टार्ट जब होता है डीएनए, सिंथेटिक फेज में डीएनए रेप्लिकेट होता है. G2 में सिंथेसिस ऑफ द सेलुलर कंपोनेंट रिक्वायर्ड फॉर माइटोसिस. और एम फेज में माइटोटिक फेज जो होता है उसमें माइटोटिक फेज सेल डिवीजन होता है, या तो G0 में चला जाता है या G1 में. तो G1 में रेस्टिंग स्टेट सेल इज़ नॉट डिवाइडिंग, वो G0 पे होता है. और G1 में सिंथेसिस ऑफ एंजाइम्स नीडेड फॉर डीएनए सिंथेसिस. दिस इज़ द सेल साइकिल. दिस इज़ द मैकेनिज्म किस तरह प्यूरिन और पिरामिडिन से राइबोन्यूक्लियोटाइड बनता है और फिर वो डीऑक्सीराइबोन्यूक्लियोटाइड से डीएनए बनता है और डीएनए फिर चेंज हो जाता है आरएनए में. आरएनए की 3 टाइप्स हैं, ट्रांसफ़र आरएनए, मैसेंजर आरएनए और राइबोसोमल आरएनए. राइबोसोमल ये 3 आरएनए के थ्रू फिर प्रोटीन्स बनता है, एंजाइम्स और माइक्रोट्यूब्यूल्स बनते हैं. दिस इज़ द सेल साइकिल फेजेस कि किस तरह माइटोटिक फेज का माइटोसिस न्यूक्लियर डिवीजन होता है और साइटोकाइनेसिस साइटोप्लाज्मिक की डिवीजन भी होती है यहाँ पे. फिर G1 और फिर इसके बाद G2 एस फेज, फिर G2 फेज. सेल साइकिल चेक पॉइंट्स जहाँ पे सेल साइकिल चेक होता है कि किस तरह आफ्टर कंप्लीशन ऑफ माइटोसिस द रिजल्टिंग डॉटर सेल्स हैव 2 option. They can either enter G1 and repeat the cycle. Second, they can G0 into G0 not participate in the cell cycle. Phases of the cell cycle. To G1 phase, cell grow in size and prepare to copy its DNA in response to various growth factor. S phase को हम synthesis phase कहते हैं, replication of DNA, copying of the chromosome. G2 phase में preparation for the cell division, check copied DNA and repair damaged copies. M phase, mitosis, formations of the mitotic spindle and separations into 2 individual cells, cell division. Control of cell cycle progressions by CDK. Progressions through the cell cycle is controlled by cyclin dependent kinases. Binding of the cyclin with its associated kinase trigger to move the cell cycle to another phase. Inhibitory proteins are present that can modify the effect of cyclin. These include P21 that is controlled by tumor suppressor protein P53. Our active cyclin or CDK have been associated with many tumors. Excessive productions of cyclin or CDK, insufficient productions of CDK inhibitors leads to disruptions of the normal regulations of the cell cycle. Telomeres. Cancer cells are often called immortal since there seems to be no limit for how often they can divide. Lifetime of normal cells is limited to 50-60 cell divisions. This is regulated by telomeres. The telomeres are at the 3 ends of the chromosomes. After each replication, about 50 to 100 base pairs are lost. At some point, telomeres are too short to be effective and the DNA becomes unstable, thereby limiting replication. Cancer cells possess an enzyme called telomerase, which maintain the length of the telomeres and thereby allow more DNA replication. Intrinsic tumor suppressions P53. In response to DNA damage, oncogenes activations or other harmful events, the tumor suppressor gene P53 is induced. Various kinase phospholipids P53 which help stabilizing it. Activated P53 result in DNA binding and transcriptional activation. P53 triggers cell cycle arrest in untransformed cells, while cell cycle regulators such as CDK. It also triggers apoptosis in transformed cells. In most tumor cells, P53 is mutated and inactivated. Uncontrolled proliferation. Result of activation proto-oncogenes RAS या inactivation of tumor suppressor genes P53. Change in growth factor receptor increase the growth factor produced. Change in cell cycle transducers, cyclin CDK inhibitors P51. Change in apop- apoptotic mechanism. Change in telom- change in telomerase expression. Principles of cancer. Principle of cancer chemotherapy. Cancer chemotherapy strives to cause a lethal cytotoxic event or apoptosis in the cancer cells that can arrest a tumor progressions. The attack is generally directed toward DNA or against metabolic sites, essentially to cell replication. For example, availability of purines and pyrimidines, which are the building blocks for DNA and RNA synthesis. Ideally, these anti-cancer drugs should interfere only with cellular processes that are unique to malignant cells. Unfortunately, most currently available anti-cancer drugs do not specifically recognize neoplastic cells but rather affect all kinds of proliferating cells, both normal and abnormal. Purines and pyrimidine synthesis. This is the drugs and this is the all drugs of antineoplastic. First is a 6-mercaptopurine thioguanine inhibit synthesis of purine ring. Methotrexate inhibit dihydrofolate. 5-fluorouracil inhibit DTMP synthesis. Uh, Cetarabine terminate DNA chain, and bleumycin, doxo, doxorubicin, and diorubicin. This is their drugs, and dactinomycins and doxorubicins and dinorubicin. Alkylating agent nitrosurase and cisplatin. This is the drugs. How it works? Mechanism of actions of antineoplastic drugs. This is the main start of antineoplastic drugs. Important. Number 1, prevent DNA synthesis. Number 2, disturb DNA या prevent DNA repair, and prevent RNA synthesis. Number 3, interrupt mitosis. 4, interfere with protein or hormone synthesis. Goal of chemotherapy. The goal is to eradicate the cancer cells without affecting normal tissue. The reality is that all cytotoxic drugs offer normal tissue as well as malignancies due to a narrow therapeutic index. Goal of cancer treatment. Curative, the total eradication of cancer cells. Curable cancers include testicular tumors, Wells tumor. Palliative, alleviation of symptoms, avoidance of life-threatening complications, increased survival, and improved quality of life. Adjuvant therapy, attempt to eradicate microscopic cancer after surgery, breast cancer and colorectal cancer. Classification of cancer drugs. Cancer drugs can be divided into two general classes: cell cycle specific drugs, plant alkaloid and antimetabolites, and cell cycle non-specific drugs. Alkylating agent and some natural products. Antineoplastic agents can also be organized according to their chemical classes, mechanism of action, and therapeutic use or their toxicity. Cell cycle specific drugs are antimetabolites, bleumycin, vinca alkaloid, etoposide, effective for high growth fraction, malignancies such as hematologic cancer. Cell cycle non-specific drugs, alkylating agent, antibiotics, cisplatin and nitrosurase, effective for both low growth fraction malignancies such as a solid tumor as well as high growth fractions malignancy. Toxicity. Toxicity therapy aimed at killing rapidly dividing cells. Cancer cells also affects normal cells undergoing rapid proliferations. For example, cells of the buccal mucosa, bone marrow, gastrointestinal mucosa, and hair follicles, contributing to the toxic manifestations of chemotherapy. Common adverse effects. Most chemotherapeutic agents have a narrow therapeutic index. Severe vomiting, stomatitis, bone marrow suppressions, and alopecia occur to a lesser or greater extent during therapy with all antineoplastic agents. Vomiting is often controlled by administrations of antiemetics. Some toxicity, such as myelosuppressions that predisposes to infections, are common to many chemotherapeutic agents, whereas other adverse reactions are confined to specific agents such as bladder toxicity with the cyclophosphamide, cardiotoxicity with the doxorubicins, and pulmonary fibrosis with bleomycin. The durations of the side effects varies. General uh, General problems with anti-cancer drugs. Side effects greatest in other rapidly dividing cells, bone marrow toxicity, impaired wound healing, hair follicle damage, GI epithelium damage, growth in children, gametes and fetus may themselves be carcinogenic. Anti-cancer drugs, anti-metabolite, antibiotic, alkylating agent, microtubule inhibitor, topoisomerase inhibitor, tyrosine kinase inhibitor, hormones, monoclonal antibodies, platinum complex compound. Antimetabolites drugs. Antimetabolites are structurally related to normal compounds that exist within the cell. They generally interfere with the availability of normal purines or pyrimidine nucleotide precursors, either by inhibiting their synthesis or by competing with them in DNA or RNA synthesis. Their maximal cytotoxic effects are in S phase and are therefore cell cycle specific. Methotrexate MTX, pre, uh, primit, Primitrexate, and Pralatrexate are antifolate agent. Classification of antimetabolites: folic acid antagonist methotrexate, purine antagonist 6-mercaptopurine, pyrimidine antagonist 5-fluorouracil. Mechanism of action: methotrexate is structurally related to folic acid and act as an antagonist of the vitamin by inhibiting dihydrofolate reductase, the enzyme that converts folic acid to its active coenzyme form tetrahydrofolate required for thymidine and purine synthesis. MTX is specific for the S phase of the cell cycle. Pemetrexate is an antimetabolite similar in mechanism of methotrexate. However, in addition to inhibiting dihydrofolate reductase, it also inhibits thymidylate synthase and other enzymes involved in folate metabolism and DNA synthesis. Pralatrexate is a newer antimetabolite that also inhibits this therapeutic uses. Methotrexate, usually in combination with other drugs, is effective against acute lymphocytes leukemia, Burkitt lymphoma in children, breast cancer, bladder cancer, and head and neck carcinomas. Primotrexate is primarily used in non-small cell cancer, lung cancer. Pralatrexate is used in relapsed or refractory T-cell lymphoma. Adverse effects: methotrexate is myelosuppressive, producing severe leukopenia, bone marrow alopecia, and thrombocytopenia. This agent may produce severe gastrointestinal disturbance. Renal toxicity may occur because of precipitations, crystalluria of the 7-OH metabolite of methotrexate. Purine antagonist 6-mercaptopurine CMP. The drugs are believed to act similarly to inhibit purine based synthesis, although their exact mechanism of action are still uncertain. Indication: mercaptopurine is used primarily for the maintenance of remissions in patients with acute lymphocytic leukemia and is given in combination with methotrexate for this purpose. Adverse effects well tolerated. Myelosuppression is generally mild. With this drug, long-term mercaptopurine use may cause hepatotoxicity. Pyrimidine antagonist 5-fluorouracil mechanism of action. Fluorouracil is an analog of thiamine in which the methyl group is replaced by a fluorine atom. 5-fluorouracil is converted to 5-fluorodeoxy deoxyuridine monophosphate, which competes with deoxyuridine monophosphate for the enzyme thymidylate synthetase and prevents the synthesis of thymidine, a major building block of DNA. Pyrimidine antagonist 5-fluorouracil indication. Fluorouracil is exclusively used to treat solid tumor, especially breast, colorectal and gastric tumor, and squamous cell tumors of the head and neck. Adverse effect: fluorouracil may cause nausea and vomiting and myelosuppressions. Oral and gastrointestinal ulcerations, nausea and vomiting are usually mild. Pyrimidine antagonist citrabine. Citrabine acts as a pyrimidine antagonist indication. Citrabine has a narrow clinical spectrum and is primarily used in combination with daunorubicins for the treatment of acute non-lymphocytic leukemia. Adverse effect: high doses of citrabines can damage the liver, heart, and other organs. Anti-tumor antibiotics. Anti-tumors antibiotic their cytotoxic action primarily to their interactions with DNA, leading to disruptions of DNA functions. In addition to intercalations, their abilities to inhibit topoisomerase 1 and 2 produce free radicals also play a major role in their cytotoxic effects. They are cell cycle non-specific, with bleomycin as an exception. Antibiotic anthracycline, doxorubicins, adramycins या daunorubicin, bleomycin, actinomycin D, and mitomycin. Doxorubicins and daunorubicin mechanism of action. These drugs intercalates between base pairs, inhibit topoisomerase 2, and also generate free radicals. They block RNA and DNA synthesis and cause strand scission. Adverse drug reaction: cardiac toxicity due to generations of free radicals, acute form, arrhythmus, ECG changes, pericarditis, myocarditis, chronic form, dilated cardiomyopathy, heart failure. Rx with dexarosins. This is an inhibitor of iron-mediated free radical generations, bone marrow suppressions, total alopecia. Mitomycin C mechanism. Mitomycin C is an antineoplastic antibiotic that alkylates DNA and thereby cause strand breakage and inhibition of DNA synthesis. Indication: it is primarily used in combination with virestine as a salvage therapy for breast cancer. Adverse effects: mitomycin produce delayed and prolonged myelosuppressions that preferentially affect the platelets and leukocytes. Actinomycin D intercalates DNA and thereby prevents DNA transcriptions and messenger RNA synthesis. The drug is given intravenously and its clinical use is limited to the treatment of trophoblastic gestational tumors and the treatment of pediatric tumors such as Wilms tumors and Ewing's sarcoma. Bleomycin mechanism. The drug has its greatest effect on neoplastic cells in the G2 phase of the cell replication cycle. Although bleomycin intercalates DNA, the major cytotoxicity is believed to result from iron, uh, iron, iron catalyzed from radical formations and DNA strand breakage. Indication: it is useful in Hodgkin and non-Hodgkin lymphomas, testicular cancer, and several other solid tumors. Adverse effects: bleomycin produces very little myelosuppressions. The most serious toxicity of bleomycins are pulmonary and mucocutaneous reaction. Alkylating agent exert their cytotoxic effects by covalently binding to DNA. Alkylation of DNA is probably crucial cytotoxic reaction that is lethal to the tumor cells. Alkylating agents do not discriminate between cycling and resting cells, even though they are most toxic for rapidly dividing cells. They are used in combination with other agents to treat a wide variety of lymphatic and solid cancer. In addition to being cytotoxic, all are mutagenic and carcinogenic and can lead to secondary malignancy such as acute leukemia. Alkylating DNA, monoalkylation, inter, intercalations, या cross-linked alkylating agent. One of the frightening development of World War I was the introduction of chemical warfare. These compounds were known as a nitrogen mustard gases. The nitrogen mustard were observed to inhibit cell growth, especially of bone marrow. Shortly after the war, these compounds were investigated and shown to inhibit the growth of cancer cells. Mechanism of action: nitrogen mustard inhibits cell reproductions by binding irreversibly with the nucleic acid DNA. Specific type of chemical bonding involved is alkylation. After alkylation, DNA is unable to replicate and therefore can no longer synthesize proteins and other essential cell metabolites. Consequently, cell reproduction is inhibited and the cell eventually dies from the inability to maintain its metabolic functions. Alkylating agents: cyclophosphamide, busol, bu, busulfan, and carmostine, lomostine, milphalan, and TEP. Alkylating agent cyclophosphamide. It is a prodrug that is activated by the P450 enzymes to its active form phosphoramide mustard. The active drug alkylates nucleic growths on DNA bases, particularly at the N7 position of guanine. This leads to क्रॉस लिंकिंग ऑफ बेसिस एबनॉर्मल बेस इंडिकेशन. इसका इंडिकेशन है कि डीएनए स्ट्रैंड ब्रेक इट इज़ यूज इन द ट्रीटमेंट ऑफ क्रोनिक lymphocytes leukemia, non-Hodgkin lymphomas, breast and ovarian cancer, and a variety of other cancers. It is also a potent immunosuppressant. It is used in the management of rheumatoid disorders and autoimmune nephritis. Adverse effect: alopecia, nausea, vomiting, and myelosuppressions, and hemorrhagic cystitis. Alkylating agent nitrous urus, carmostine, lomostine. Carmostine and lomostines are closely related nitro sources. Nitro sources are highly lipophilic and reach cerebrospinal fluid concentration that are about 30% of plasma concentration. Mechanism of action: nitro source exert cytotoxic effect by an alkylation that inhibit replication and eventually RNA and protein synthesis. Indication: because of their excellent CNS penetration, and carmostine and lomostine have been used in treat brain tumor. Alkylating agent: phenylalanine and nitrogen mustard. Melphalan and alkylating agent, which is a phenylalanine derivative of nitrogen mustard. Although melphalan can be given orally, the plasma concentration differs from patient to patient due to variation in interstitial absorption and metabolism. Melphalan is primarily used to treat multiple myeloma, plasma cells myeloma, breast cancer, and ovarian cancer. Alkylating agent alka-sulfonate and busulfan. Busulfan is administered orally to treat chronic granulocytic leukemia in aged patients. Busulfan can cause pulmonary fibrosis, busulfan lungs, like other alkylating agents. All of these agents are leukomogenic. Adverse effects. uh, busul, Busulfan produces adverse effects related to myelosuppression. It only occasionally produces nausea and vomiting. In high doses, it produces a rare but sometimes fatal pulmonary fibrosis. Busulfan lungs. Alkylating agents. Thiotepa is converted rapidly by liver to its active metabolite triethylene phosphoramide. It is active in bladder cancer. Microtubule inhibitors. Mitotic spindle is part of larger intracellular cytoskeleton that is essential for the movement of structures occurring in the cytoplasm of all eukaryotic cells. The mitotic spindle consists of chromatin pulse, a system of microtubules composed of the protein tubulin. The mitotic spindle is essential for the equal partitioning of the DNA into the two daughter cells that are formed when the eukaryotic cell divides. Several plant-derived substances used as anti-cancer drugs disturb this process by affecting equilibrium between the polymerized and depolymerized form of microtubules, thereby causing cytotoxicity. Microtubules inhibitors, tubulin binding agents. Vinca alkaloid. The cellular mechanism of action of vinca alkaloid is the prevention of microtubule assembly, causing cells to arrest in the late G2 phase by preventing formations of mitotic filament for nuclear and cell division. Vinblastine and vincristine and vendicin and venorelabine are all alkaloids derived from the pre-vincal plant Vinca rossi. Mechanism of action of microtubule inhibitor. Vincalcaloid indication. Vincablastine is used in combination with bleomycin and cisplatin for metastatic testicular tumors. Vincristine is used in combination with predenosins to induce remissions in childhood leukemia. Vinorelabine is used to treat non-small cells lungs cancer and breast cancer. ADR. Severe neurotoxicity, paresthesis, loss of reflexes, foot drop, and ataxia. Microtubules inhibitors. Paclitaxels and docetaxels. Taxane. These drugs act by interfering with mitotic spindle by preventing microtubule disassembly into tubulin monomers. Mechanism of action. Both drugs are active in M phases of the cell cycle, but unlike the Vinca alkaloids, they promote polymerizations and stabilizations of the polymers rather than disassembly, leading to the accumulation of microtubules. The overly stable microtubules formed are non-functional and chromosomes desegregations does not occur. This results in death of the cells. Therapeutic uses. Docetaxel and paclitaxel have become central component of regimens for treating metastatic ovarian, breast, lung, and head and neck cancers. Paclitaxel stabilizes microtubules, rendering them non-functional. Hormones. Several types of hormone-dependent cancer, especially breast, prostate, and endometrial cancer, respond to treatment with their corresponding hormones antagonists. Estrogen antagonists are primarily used in the treatment of breast cancer, whereas androgen antagonists are used in the treatment of prostate cancer. Corticosteroids are particularly useful in treating lymphocytic leukemias and lymphomas. Glucocorticoid, they are integral component of curative therapy for acute lymphocytic leukemia, non-Hodgkin lymphoma, and Hodgkin disease. Pred, uh, pred, prednisone is a potent synthetic anti-inflammatory corticosteroid at high doses, lymphocytolytic, and leads to hyperuricemia due to the breakdown of lymphocytes. Prednisone is primarily employed to induce remissions in patients with acute lymphocytic leukemia and in the treatment of both Hodgkin and non-Hodgkin lymphomas. Tamoxifen is an estrogen antagonist with some estrogenic activity, and it is classified as a selective estrogen receptor modulators. It is used for first line therapy in the treatment of estrogen receptor positive breast cancer. Mechanism of action: tamoxifen binds to estrogen receptor in the breast tissue, but the complex is unable to translocate into nucleus for its action of initiating transcriptions. That is, the complex fails to induce estrogen response and RNA synthesis does not occur. The result is a depletion of estrogen receptors and the growth promoting effects of the natural hormones and other growth factors are suppressed. EDR, hot flushes, vaginal bleeding, and venous thrombosis. Aromatase inhibitor. Aromatase reaction is responsible for the extra-adrenal synthesis of estrogen from adrenosteroids. This takes place in liver, fat, muscle, skin, and breast tissue, including breast malignancy. Peripheral aromatization is an important source of estrogen in post-menopausal women. Aromatase inhibitor decrease the production of estrogen in these women. Anastrozole and letrozoles are aromatase inhibitor. These drugs inhibit the aromatase enzyme used in attacks of postmenopausal women with metastatic breast calcium. EDR include bone pain and peripheral edema. Estrogen had been used in the treatment of prostatic cancer. Estrogen inhibits the growth of prostatic tissue by blocking the production of luteinizing hormone, thereby decreasing the synthesis of androgen in the testes. Thus, tumors that are dependent on androgen are affected. Adverse effect: estrogen treatment can cause serious complications such as emboli, myocardial infarction, strokes, and hypercalcemia. Men who are taking estrogen may experience gynecomastia and impotence. GnRH analog, leprolide, and goserelin and triptolin, effective in malignant of prostatic carcinomas. When given in constant doses, they inhibit release of pituitary LH and FSH. These drugs suppress gonadal functions due to downregulation and desensitization of HNRH receptor. ADR leprolide may cause gynecomastia, hematuria, impotence, and testicular atrophy. Monoclonal antibodies. They are created from B lymphocytes from immunized mice and hamsters fused with immortal B lymphocytes tumor cells. The resulting hybrid cells can be individually cloned, and each clone will produce antibodies directed antagonist a single antigen type. Currently, several monoclonal antibodies are available for the treatment of cancer. Trastuzumab and rituximab and bevacizumab and cetuximab monoclonal antibodies have become an active area of drug development for anti-cancer therapy and other non-neoplastic disease because they are directed at specific target and often have fewer adverse effects. Platinum coordination complexes cisplatin, carboplatin, and oxaliplatin. Cisplatin was the first member of a platinum coordination complex class of anti-cancer drugs. Mechanism of action for this class of drugs is similar to that of alkylating agent. It binds to guanine in DNA, forming inter-strand cross-link. The resulting cytotoxic lesions inhibit both polymerase for DNA complication and RNA synthesis. Cytotoxicity can occur at any stage of the cell cycle, but cells are most vulnerable to the actions of these drugs in the GI and S phases. Cisplatin, carboplatin, and oxaliplatin adverse effect. Severe persistent vomiting occur for at least 1 hour after administration of cisplatin and may continue for as long as 5 days. Pre-medications with antiemetics agents is required. The major limiting toxicity is dose-related nephrotoxicity involving the distal convoluted tubules and collecting ducts. This can be prevented by aggressive hydration. Topoisomerase inhibitors. These agents exert their mechanism of action via inhibition of topoisomerase enzymes, a class of enzymes that reduce supercalling of DNA. A campo, a, a campo Chemtosins are plant alkaloid, originally isolated from the Chinese trees Cryptotheca. Mechanism of action. These drugs are S-phase specific and inhibit topoisomerase 1. Adverse effect: bone marrow suppressions, neutropenia, and etoposide is a semisynthetic derivative of plant alkaloid. It blocks cells in the late S2G2 phase of the cell cycle. Its major target is topoisomerase 2. Dose limiting myelosuppressions, primarily leukopenia, is the major toxicity. Tyrosine kinase inhibitor. Tyrosine kinase are family of enzymes that are involved in several important processes within a cell, including signal transductions and cell divisions. Many tyrosine kinase inhibitors are available, and these agents have a wide variety of applications in the treatment of cancer. Tyrosine kinase inhibitor, imatinib, dasatinib, and nilotinib. Amitanib is used for the treatment of chronic myelogenous leukemia. It acts as a signal transduction inhibitor used specifically to inhibit tumor tyrosine kinase activity. The ability of amitanib to occupy the kinase pocket prevents the phosphorylation of tyrosine on the substrate molecule and hence inhibits subsequent steps that leads to cell proliferation. These agents are all available in oral formulations, and they are associated with notable toxicity such as fluid retention and QT prolongation. Miscellaneous agents: asparginase and interferon. Asparginase, L-asparginase, catalyzes deamination of aspargine to aspartic acid and ammonia. L-asparginase is used in combination therapy to treat childhood acute lymphocytic leukemia. Its mechanism of action is based on the fact that some neoplastic cells require an external source of aspargine because of their limited capacity to synthesize sufficient amount of that amino acids to support growth and function. As asparginase hydrolyzes blood aspargines uh, and thus deprives the tumor cells of this amino acid, such as needed for protein synthesis. Interferon. Human interferon are biological response modifiers Mechanism of action: interferon interact with the surface receptor on their cells, at which sites they exert their effects. Bound interferon are either inter nor degraded as a consequence of the binding interferon. A series of complex intracellular reactions take place. These include synthesis of enzymes, suppressions of the cells, proliferations, activations of macrophages, and increased cytotoxicity of lymphocytes. However, the exact mechanism by which the interferon are cytotoxic is unknown. Interferon is a recently approved for the management of hairy cell leukemia, chronic myeloid leukemia, and acquired immunodeficiency syndrome related Kaposia sarcoma. Prevention: management of cancer, chemotherapy, nausea and vomiting, 5-HT3 antagonist on densitron, bone marrow suppression, filgrastim, colony stimulating factor, MTX toxicity, leucovorin, folic acid, cyclophosphamide toxicity, MESNA, cisplatin toxicity, amifostine, anthracycline toxicity, dexorozazone. This is the end of lecture. Thank you.